All right, good morning, everybody. Gonna let a few other people in. Gonna wait a few seconds while I take my energy drink here. This is the Unimate drink. You guys have seen this when you come into the office. I'm gonna open my chat box on this side. Then we're gonna get started. I'm gonna try to keep it down to an hour or less today. And if you can hear me, let me know as soon as I open my chat box up. All righty. Let's see. Well, sometimes, even when I'm trying to get as healthy as possible, I gotta put my glasses on. All right. Let me see here. Chat box. There it is. Everybody can hear me. Great. All right. This is the energy drink. This is the drink it's called Unimante. Many times when I tell you to take this fiber and all that, I'll compare it, I'll combine it with the Unimante, and that kind of gives you the energy to work out. And I'm going to basically, this is going to be a little bit special, primarily because of what a patient told me this week that inspired me for this talk. And she says, Doc, I've been listening to your webinars, and you've been dogging these other physicians saying, hey, listen, all you got to do is take this drug and go work out and eat healthy. So well, you're doing kind of the same thing. I says, really? So I'm all ears now, right? So this is yeah. You're telling us how to eat, and so we know how much a chicken breast and a chicken thigh and some pea protein. We know how much that is. All right, and basically you've been telling us how to eat, and that's a good thing. But you tell us to go out and exercise. You tell us to go out there and do some strength training, and you never tell us what to do. So we have um, Andrea Riggs, who is our personal trainer, and she's going to be involved with making the app that I talked about last week. And that app is going to be, giving you exercises to do. And I'm going to actually show you some of the exercises that I do today. And I'm going to show you what resistance training really means and what we're going to do as resistance training. Because we're going to start, if you know, the interesting thing about it is that everybody that came in, and I'll ask it here as well. Everybody that came in, I says, okay, fine. What kind of exercises are you doing? Everybody's walking. Okay, what kind of resistance training are you doing? And that's kind of how that conversation with that particular patient got started. I ain't doing it. I don't know what to do. Yeah, I can go to the gym, get a personal trainer, but that's expensive, and it is. But and so we're gonna make it less expensive for you because we're gonna actually give it to you on the app. But yeah, how many people are actually actively doing resistance training 2 or 3 times a week? Put it in the chat box. Let me just kind of I'm going to take a wild guess because everybody that I asked in the office this past week, some 50 people or so, said that they weren't really doing it, that they weren't doing it consistently. 60, 70, 80% of them said that, yeah, I am doing my walking every day, or I'm doing my walking at least 3 or 4 times a week. So just to get kind of started while I let other people in, how many of you all are actually doing resistance training? Do you know what it is? All right. All right. I do resistance training at least 4 times a week. Okay. Got one person. So does that mean everybody else here is kind of in the same boat and really, really wants me to talk about it? I'm going to talk about it anyway because I'm going to show you what resistance training is. I'm going to show you uh, because I have a good friend of mine who says, yeah, doc, I go to the gym every day. I do the resistance training every day. And he gets on the machines. And he's a big guy. I did his surgery years and years ago. But he's lost a lot of muscle mass, primarily because he regained the weight, got on some GLP-1 drugs, lost some muscle mass. And he's in his 40s, late 40s. And so getting your muscle mass back at that age is going to be very, very difficult. Very difficult. And so when he showed me what he was doing when he went to the gym, he was lifting like 15 pounds. Well, this guy's a 6'2" guy. and he's just lifting up 15 pounds of dumbbells. And he was just kind of almost kind of just like, okay, yeah, see, I get. And so what he thought was maintaining muscle mass was just maintaining tone. So this was giving him what he thought was tone. I says, no, that's not it. And so then when I got the comment from the patient this week, I says, I got to talk about that because there's obviously a disconnect between what is muscle protein synthesis, what it takes to maintain muscle mass as you've lost the weight, as we've aged, and as we have this problem with excess fat in our body. The fat in our body makes the signal for muscle protein synthesis, even maintenance. It makes that signal very, very, very dim. And so we really got to hit that muscle protein signal with a little bit more. So most of us have excess fat. No, I do have excess fat, and at that excess fat, my insulin resistance before, along with my age, puts me at increased risk for losing muscle mass. Now, why am I making a big deal about muscle mass? Well, you know the answer to that. It's our number one metabolic engine. Without it, we're going to become frail. Without it, we're not going to be able to travel. Without it, all those things that we wanted to, as far as the reason for losing weight in the first place, those dreams aren't going to come true without maintaining muscle mass. All right. So I've spent a lot of time on telling you what to eat, and I'm going to mix a little bit of that in there as well. I spent a lot of time on telling you what to stay away from. The refined carbohydrates, which gives you the glucose spikes, which gives you the insulin spikes, which makes you insulin resistant. We've all got that. We've all got that. And that's what we're trying to correct. But that fact alone, the insulin resistance, meaning that our muscles are insulin resistant, meaning that we're supposed to take whatever glucose we're putting into our mouth and it's supposed to go to our muscles first. That's what we need. Our muscle is our primary metabolic engine and it needs the fuel, and the primary fuel it needs is glucose. If those cells, those muscle cells, are insulin resistant, the glucose ain't going to go there. The glucose is going to knock on the door and say, hey, 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 I need to come in. The insulin is going to try to push it in. Insulin is the cells are insulin resistant. The muscle cells are going to say, hey, I don't hear you. You got to speak louder. And so if it doesn't speak louder soon enough, it's going to push that glucose where? Into the fat. The fat is very receptive of glucose. It turns basically you put glucose in there, and you get de novo gluconeogenesis. I don't really mean to use big words, but that means taking glucose and making it into fat, which we thought was impossible back in the 1970s and all that. That's why we put these low-fat products on the shelves at Publix and all the other grocery stores, because we thought fat caused fat. And it's not true. We now know, and I'm hoping everybody here knows, that it ain't the fat that we eat that causes fat. We need that fat. It's the glucose that we're eating that breaks down, and that causes fat. Okay, so I'm gonna look in the chat box one more time. Who else eat? Say I do resistance training. Uh-oh. So somebody put a big red X there. I've not started resistance training. I need guidance on resistance training. Not doing it this time, but I am stretching daily to strengthen muscles in my back and quads. Okay. So it's obvious something that I need to talk about. I'm going to talk about it. All right. So let me go ahead and get started. I'm going to make this as short as possible. We have a couple of 8-minute videos that I'm going to show you. Then I'm going to show you a slide presentation. Then I'm going to show you how I do the resistance training and what I mean by doing resistance training. I'd like you all to start with just the bands, the resistance bands, or the machines, because just to start with free weights, the free weights are kind of more advanced. You got to have balance at the same time. And so you can, as you're getting more and more your muscle back, the safe way to do it is to start with the machines, because if you drop, if it gets too heavy and your muscles kind of give out, you got protection. The free weights, not so much so. So to do things safely, we're going to start with the machines. And so where am I going to get a machine from? Well, yeah, that's going to be a controversial topic. Do I need to get a gym membership? They got all these cheap gym memberships, and I'm just going to put it out there and say, at some point in time, we've got to take our health seriously, and we got to figure it out. Going to the gym is not going to be one of my favorite things to do. That's why I set my gym up here in my living room. It doesn't look too cool. Matter of fact, it doesn't go very well with the grand piano, does it? But anyway, I set it up here because I don't have the time to go to the gym all the time. And I know that that's what y'all are telling me. Yeah, I got to pick up the kids. I got to go to practice. I got to go to soccer practice. I just don't have time to go to the gym. At some point in time, we've got to take the time in order to take care of our lives. All right. All right. So I'm going to share my screen and get into it. And I'm going to be telling you some things about this. You're going to maybe hear on this thing about 60 to 80% of your one rep max. And I want you to know what that is. But you got to test that to see what it is your one rep max. In other words, you're going to take a weight or a machine, and you're going to say, okay, fine. In good form, how much weight can you lift? I'll give you a perfect example. In good form, in order for me to do my one rep max, this is what I started out with. I'm going to show you. This is a 40-pound weight. Okay, good form. I'm going to take that. That's pretty good form, and I can do that one time with one arm. Okay, so what I mean by 60 to 80%, you're going to start with 60%. 60% of 40 is 24. 6 times 4 is 24. So my regular workout weight is 25. All right. So 60%, you see the 25. All right. So I'm not gonna do around about 6 to 10 of these reps, but I'm gonna do it to failure, to where the last rep is gonna be difficult for me to do in good form. If I can't get up in good form, I'm through. All right. So I did around about 6 there, and I was through. Right. So that's the principle. Because doing what my buddy did, just throwing it up there and saying I'm getting muscle tone, it's not giving your muscles the loud enough signal that it needs in order to induce muscle protein synthesis. And it's certainly not enough to maintain it, especially when you're losing weight. So we're going to talk about that. All right. I think I got enough people here now. I'm going to go ahead and share my screen. And I'm going to go ahead and do number 1 here. If I can. Hope you can hear this. I'm going to test it out first. And then I'm going to look in the chat box and ask you guys if y'all able to hear it, okay? Sure.
Welcome to this explainer. I'm absolutely thrilled to dive into the...
Can you hear that? Everybody? Okay? Gotcha. All right.
This one with you today. We're going to completely dismantle a myth that has probably been frustrating you for years. Literally. You know the one, the golden rule of dieting that just says, hey, eat less and move more. Well, what if following that classic advice without a very specific strategy is actually destroying your metabolism?
Yeah, you heard that right. What if the standard advice to eat less and move more is actually accelerating your aging process? It sounds completely backwards, doesn't it? But guys, this is the ultimate dieting paradox. If you just drastically restrict calories and do a bunch of random cardio, the weight you're dropping isn't just fat. You might actually be priming your body to get fatter in the long run, simply because you're losing the entirely wrong kind of weight.
Okay, let's dive right into section 1, the weight loss paradox.
Let's look at the actual biological reality of what happens when we just, cut our calories, cross our fingers, and hope for the best. When you go on a standard diet, or honestly, even after bariatric surgery, a massive chunk of the weight you lose right out of the gate is actually fat-free mass. We are talking 20 to 30% of the total weight lost. That's huge. And as the research clearly highlights, your skeletal muscle declines the most sharply in those critical first 3 months of weight loss. So why is that so terrifying?
Well, because it directly leads to accelerated aging. You see, muscle isn't just there to look good at the beach or to help you carry heavy groceries. It is literally your primary metabolic engine. When you lose muscle tissue through traditional calorie-restrictive dieting, you are permanently lowering your resting metabolic rate. You're literally downgrading your body's engine, which perfectly primes your system for rapid fat regain the very second you stop that diet.
Which brings us to section 2, muscle, the metabolic engine.
If you really want sustainable fat loss, you absolutely have to protect the machinery that does the heavy lifting. Think of your body like a high-performance sports car. The bigger the engine, the more fuel it burns just sitting in the driveway, right? Muscle acts exactly the same way. It's constantly clearing glucose from your blood and burning calories around the clock. And this brilliantly illustrates the ultimate hidden danger here, sarcopenic obesity. That's what happens when you lose that highly valuable muscle mass, but actually retain your fat mass over time. You end up with a much smaller metabolic engine, which totally ruins your functional ability and sets you up for frailty as you age. So our true goal here isn't just seeing a lower number on the bathroom scale, it's reduced adiposity while optimizing that muscle mass.
So you might be wondering, why on earth does our body do this to us? Well, biologically speaking, muscle is what we call metabolically expensive overhead. When you're in a calorie deficit, your body panics. It enters survival mode. It looks at your muscle like an expensive luxury sports car during an economic recession and basically says, yeah, we can't afford the gas for this anymore. Let's dump it. Your body will naturally prefer to shed your muscle tissue just to become more energy efficient, unless you give it a massive, undeniable reason not to.
Let's move to section 3, the mechanical override signal.
We need a hard biological mandate to stop the body from basically eating its own engine. We need a mechanical override signal. Now, a lot of people think going for a brisk walk or just logging miles on the treadmill is enough to save their muscle. But unfortunately, random movement completely fails here. To send a loud and clear survival signal to your central nervous system, your body strictly requires progressive resistance training. You literally must induce profound mechanical tension across your muscle fibers by pushing them to a close proximity of failure, about 2 to 3 times per week. You have to mechanically tell yourselves, hey, maximum force production is absolutely required for my survival right now.
So what kind of tools should you actually use for this strength training? Well, both free weights and seated machines are fantastic at delivering that vital mechanical tension. Free weights, like a classic barbell squat, require a lot of balance and they recruit your connective chassis and all those little stabilizing muscles. Seated machines, on the other hand, well, they require less balance, but they are incredibly effective at safely isolating the muscle to deliver that exact tension you need. The bottom line, your body actually has no idea what you're holding, it just feels the mechanical load.
Let's transition to section 4 and see how this builds into the overweight protein paradox.
All right, so we've covered the mechanical signal in the gym. Now let's look at the nutritional signal in your kitchen. If you're currently carrying excess body fat, that fat actually creates what researchers call metabolic noise. It causes chronic inflammation and insulin resistance. And because of all this internal static, your muscles actually become deaf to standard protein signals. It's a biological state known as anabolic resistance. This means that overweight individuals actually require a much louder signal, meaning substantially more protein, just to trigger the exact same muscle maintenance response that a leaner person gets super easily.
Now, I can already hear you asking, but wait, doesn't eating too much protein stop fat burning? I hear this fear all the time. And the honest answer is, well, temporarily, yes. Any excess protein you eat is oxidized or burned for energy in the short term. But here is the crucial reframe you need to make. This is a completely necessary trade-off. You are using that protein for fuel during digestion specifically so you can protect your metabolic engine, your muscle, which is what actually drives your fat loss for the other 21 hours of the day.
Okay, section 5, hitting the leucine threshold.
So exactly how loud does this nutritional signal need to be? Let's break down the exact math required to shout over that metabolic noise. Now, what's really interesting about the data here is that it reveals a stark difference in muscle preservation based strictly on your protein intake. Consuming double the standard recommended dietary allowance of protein, which lands at roughly 1.6 grams per kilogram of body weight, significantly preserves your fat-free mass during weight loss. Bumping your protein up to double the RDA is basically non-negotiable if you want to keep your engine totally intact while stripping away the fat. And if we zoom in on the molecular level for a second, the absolute magic number behind that protein intake is 2.5 to 3 grams. That is the precise amount of the amino acid leucine required in a single meal to act as the ignition key. Hitting this specific leucine threshold is what explicitly turns on the mTOR pathway. That's your body's literal muscle-building machinery. Okay, but practically speaking, how do we actually get that in real life? To yield those 3 grams of leucine and effectively bypass anabolic resistance, you generally need a 30 to 40 gram serving of high-quality protein per meal. A 30 to 40 gram serving of whey protein, Greek yogurt, or one of those clear protein drinks will reliably hit that 3 gram leucine mark. You absolutely have to hit that threshold to turn the ignition key. And finally, Section 6, the 30-minute preservation blueprint. So the crucial point is we understand the biological problem and we have the exact nutritional math. Now let's put it into practice today. You absolutely do not need to live in the gym to send this override signal. This incredibly efficient bare minimum biological override requires just 3 to 5 sets per major muscle group. A full body routine that easily fits into just 30 minutes looks exactly like this. 3 sets for your legs using barbell squats or a leg press. 3 sets for your chest with a dumbbell or machine press. 3 sets for your back using lat pull downs or bent over rows. And 3 sets for your shoulders with a seated dumbbell or machine press. It's really that simple.
I want to leave you with this powerful final thought right here. We force the body to justify the metabolic cost of the muscle, preserving our biological engine against the natural drive toward frailty. By combining progressive resistance training with a high-protein, leucine-rich diet, you take total control of your metabolism. So are you willing to step up and send that survival signal? Or will you just let your body dismantle your engine? Thank you so much for joining me on this explainer, and I'll see you next time.
All right. So I realized that was a little fast. And so what I'm going to do is slow it down a second and try to explain what they were trying to say. Okay. But let me just I forgot to do one thing. I'm going to share my slides again. I'm going to share it and show I always start out with a PowerPoint presentation just so people will know that even I was once there, okay? And I'm then going to come back to that particular video and explain it a little bit more. All right, let's see if I can get this thing out the way and make it. So basically what we want to do is, this is my motto. Life's not just about living longer. It's about living healthier longer. Okay. So, and I hope that you all adapt that model too, because again, as we are seeing our current situation, let me see if I can, do I get my, yeah, as we're seeing our current situation, basically, as we're getting older, we're getting more frail, and that part of it bothers me. Because what that means is that we're going to be operating on frail people with gallbladder disease, with other problems, and they're going to be at much, much higher risk. Even the simple things like, breast biopsies and things like that. If you're frail and your immune system is down, it's going to be a riskier operation. And so there's no question that we're getting better and better at medicine. And so we're able to dodge some of these bullets sometimes. But there's no question that if we are a frail individual going into surgery, our outcome is not going to be just as good. So we're going to engineer our metabolism. And these are the 4 pillars that I talk about all the time. Fasting is primarily the main principle, but they all are just as important. Fasting, fitness, fiber, and protein. Fasting, we're going to either do a 16-8 or 18-6 fasting protocol, depending upon what day of the week it is. We have 3 and 3, 3 days of 18-6, 3 days of 16-8. All right. And what that means, just to kind of give you an idea, if you're doing an 18-6, which means you're going to do 18 hours of fasting, meaning that you're not going to get up in the morning and you're not going to drink your coffee with creamer. If you're going to get up in the morning and drink anything, it's going to be water, or it's going to be coffee, black, or tea, regular, without any sugar in it. because as soon as you put any other product in, you break your fast. And so we've all the time been breaking our fast all the time. What that means is that we're not giving our body during this fast the time to clean out our system. We've got to clean out our system. Fasting is nothing more than cleaning out our system, getting rid of the old, dead, senescent cells that have been accumulating over a period of time. Because you don't clean out your system, you don't clean out those misfolded proteins that are in our body that are stuck there until your insulin levels hit rock bottom. That's fasting by definition. Your insulin levels are going down. You basically haven't taken anything in other than water. So insulin has no reason to go up because you're not taking it in any energy source. Any sort of protein will raise your insulin as well because protein has amino acids and it is an energy source. So it won't raise it as much as a piece of toast or some orange juice, but even if it's a bacon or eggs, it'll raise it a little bit. So you cannot fast by eating food. So keep the creamer out of your coffee and all that kind of stuff. And what you'll wind up doing is cleaning out your system. And that's, trust me, that's so important because where do you think cancer cells come from? Where do you think Alzheimer's disease, that amyloid plaque we have in our brain, come from? That's a misfolded protein. Those cancer cells are cells that are just sitting there microscopically. They're abnormal, they're old, and then all of a sudden they get bombarded by inflammation. That combination of bombarded by inflammation and old senescent cells is a perfect storm for cancer. So cleaning out our system at least 2 or 3 times a week is imperative, and that's what this program does with the 18-6, 18 hours of fasting, meaning that you don't start eating your first meal until 12 noon today. Now, we adjust all those things depending upon if you work at night. But, or if you like breakfast, then you're going to start at 9 o'clock in the morning, but your last meal is going to be at 3. 6 hours of eating, 6 hours of eating, okay? And so basically, I'm just going to give you the typical example of what I do from the 12 to 6. So I go 18 hours of fasting, only drinking water and tea, unsweetened tea. It doesn't taste great to me, but it is what it is. But I know that I'm cleaning out my system every single day. I know that I'm cleaning out my brain fog, decreasing dementia. I know that, all right? Then the other 3 days, we're going to do an 18-6. That, did I say that right? I'm sorry, we're going to do a 16-8. Basically, the 16-8 is where we're going to add another dose of protein. We're basically going to add another couple of hours onto our feeding window, and that's the day we're going to work out. And I hope this is all going to make sense in just a second. Okay. So anyway, that's that first slide. Second, wrong. I got the wrong presentation. But anyway, that's me. Not so cute, but it is me with atrial fibrillation, with hypertension, with high cholesterol, with pre-diabetes, and brain fog along with it. but that's me, and this was earlier in my life, and so the time that I'm thinking that I'm supposed to really be enjoying life, this is what was happening to me. I was sick. And then I got malcongestive heart failure. I was afraid. I was afraid that I wasn't going to be around because that malcongestive heart failure, your heart muscle, when you get malcongestive heart failure, unless you turn things around, it's going to turn into congestive heart failure. And ain't a whole lot you can do about bringing that muscle of the heart back. Okay. That's me from the side. I ain't gonna see if I can make it look better, but I didn't quite make it look any better, did I? And this is when you see me purse my lips like that, that's me sucking it in. Didn't help much. Didn't help much at all. It's still sitting there. Okay. That's inflammation. That's eating and that's insulin resistance. That led to my atrial fibrillation. That led to my hypertension. That led to my pre-diabetic state because all these cells, all these white fat cells, and that's what they are, they're white fat cells, as opposed to the brown cells that are metabolically active. But these cells are constantly secreting what I call cytokines, interleukin 6, tumor necrosis factor alpha. Big words, but they mean a lot to me. To you, they should just mean that they're causing inflammation in your body. This has to go. Full stop. Full stop. All right. Now it did go. This is where I am today. So that fat went away. That atrial fibrillation went away. That mild congestive heart failure went away. That pre-diabetes went away. That cholesterol problem went away. Okay. And I said, okay, let me see if I can see something in the six pack. So here again, pursing my lips. Does it look any better? Well, yeah, I think so. This looks tremendously better than this. But this is what took me fear, took me to take my life seriously because I wanted to be around. I just, I'm in medicine. I'm making a good living. I'm doing very well, and all of a sudden, my doctor tells me I got congestive heart failure, and you better kind of slow it down or whatever you're doing, slow it down. This is my doctor telling me. Now I'm a doctor too, so I should have known better, but you know what it is. So there again, 167 pounds, 205 pounds. I got up to 215 pounds at one point in time, and it was terrible. It was terrible. It's not like what a lot of people complain about. I didn't have any problems getting on the plane and buckling my seatbelt. I didn't have any problems getting on the Ferris wheel and having the thing pushed down. I didn't have those kind of problems. My problems to me were worse. My problems to me is that, hell, congestive heart failure, seriously? So every week I got to take my dig at the GLP-1 drugs. Now, let me preface it by saying this. I use GLP-1 drugs. There's this new one coming out that I know everybody is going to try. But I have to kind of give you a prelude of caution that you have to listen to. Because these companies, I don't know if I can go towards the end of this presentation and show you where back in the 1940s, where cigarette companies were promoting cigarettes as being healthy. And so you can remember the companies have a vested interest in selling you stuff and they say, hey, you need to take it the rest of your life, and you need to take it the way we're taking it. You're going to do just fine. Remember the OxyContin story? Where we made that company billions and billions of dollars, and all the lawsuits, they were able to pay that without any problem. They're still billionaires. It's primarily because they have a vested interest and they could care less about our health. This is Dr. Boz. This is one of the YouTube influencers, but let me just kind of let's hear what she had to say.
Ozempic should not be allowed for weight loss. Mark my words. Put them in a time capsule and open it in 15 years. Ozempic has a remarkable weight loss, but what they didn't focus on is that when these people are losing weight, they are losing muscle mass at a way higher rate than they should. As you play this forward, especially in elder patients, when you lose that much muscle mass, you cannot gain it back without extreme measures. The chemistry behind how they're losing that weight is really a starvation weight loss. This is the kind of weight loss that will decrease their immune system, decrease their bone density, decrease their muscle mass, and decrease their longevity. Ozempic.
So that's where she and I agree. There's things we don't agree with. But again, these GLP-1 drugs are coming out and people are trying them. And like I said, I use them primarily because when people stall, I just use them at a low dose just to get rid of the food noise. You get rid of the food noise, that means that you're getting rid of the things that I don't want you to eat. I don't want you to eat the candy, the cookies, the pastas, and all that. I do have even a part of my program where I'll allow you to do that at some point in time, but you got to take in the fiber, the other thing that was on that 4-pillar list that we showed you. Remember, fitness, fiber, protein, and protein all day, I guess. But anyway, I know I didn't say that right. But anyway, these GLP-1 drugs, the new one that's coming out, look it up. Retatrutide. Now, retatrutide to me is going to be a game changer, primarily because it loses weight close to what surgery does, but it's a different weight. It is muscle mass loss, and that's what she's talking about here. Is that the muscle mass loss is the problem? Is that you're going to be frail and old and no walkers at the time you're 60, primarily because we're concentrating on that scale in the bathroom. We're concentrating on that number. But the reason that this thing works is it has GLP-1, it has GIP, which is tirzepatide and Mounjaro and all that. But it also has a third agonist, glucagon. And that's the key. So glucagon is responsible for pushing glucose out into the bloodstream. And it's ironic that they came up with this idea a long time ago. Glucagon used to be the enemy. Because you think about it, you push glucose out into the blood system, the body has to get it somewhere. So glucagon, we try to keep that down, all right? But if you combine that glucagon with GLP-1 and GIP, all of a sudden it does its secondary job. What is glucagon's secondary job? Increased thermogenesis, increased burning of fat, increased burning of everything. You can sit on your couch. You can sit in your couch with retatrutide and you will lose weight. Not the weight that you want to lose, but you'll lose weight. Now, everybody who's looking for a quick fix, you're going to try that, right? I hope not, but I'm just going to tell you that you heard it here first. Maybe not. Maybe you heard it from somewhere else. Sitting on the couch and losing weight, is that what we're going to now? A quick fix to the point that we don't have to do anything at all. You can lose weight by eating donuts and sitting on the couch. Is that where we're going? Is that really where we're going? That's how they're going to push this out to you. So you ain't got to do all that sweating. And I'm appealing to some people out there say, "Ooh, when is that coming out?" But please don't let it go that route, because God didn't mean for you to sit on the couch, eat donuts, and to lose the fat. And so what happens is that they're going to say, yeah, you need to continue to lose weight. You're going to continue to need to take this drug the rest of your life. You're going to lose so much muscle mass. And as you age, you are not going to get it back. So your later years in life aren't going to be cool. They're not going to be good. Trust me on that. Let's just not wait till it happens, because we didn't have to wait. Well, we did. We found out that, promoting cigarettes as healthy in the 1940s, that was a cool thing. But later on, we found out that it caused some problems, didn't we? Later on, we began to suffer from heart disease, from lung disease, from lung cancer, from COPD. We found out later on. Let's not go down that same pathway again. The same thing with the OxyContin and all that. Let's not always go down that pathway of trying to find a drug that we could pop into our mouths or we can inject into our system and beat the system, because you're not going to beat the system. Your biohacking of your body is your body will always win. It'll push back and say, hey, listen, you abused me. So this is another one. This is a clinical study that came out that showed that weight returns 4 times faster. And let me tell you, all these studies that come out, the reason that I emphasize these studies, and I says, well, that's interesting that they said they get 18, 22%, 26% body weight loss with these drugs. But what actually happens is that the real life versus the drug trials, what do you have in drug trials? You have support, you have nursing support, you have dietitian support, you have check-ins you got to do. All right, so they get these great numbers, 15 to 20% weight loss. But when you did, this is a study done by New York University. In the real world, when they put their patients out there and followed them for a long period of time, when the people were getting these drugs offline, they were going to the doctor, getting the drugs, and what did the doctor tell them? Exercise and eat right. exercise and eat right. What are you going to do with that? So in the real study, most of the people in that real study over a period of 2 years only lost 5.7%. Quite dismal, as a matter of fact. Bariatric surgery, I'm not going to throw that in there saying that you're going to, but bariatric surgery has one advantage over the GLP-1 drugs, is that bariatric surgery activates your GLP-1 internally, your own GLP-1. GLP-1 internally only stays up a brief second when you take in a protein meal or some fiber. That's all it's supposed to. It's supposed to make you feel full at the right time. You biohack the system by giving it to you in the form of a shot, bypassing your gastrointestinal tract. And it goes to your brain and you say, I'm full. I just ate a full meal when you hadn't eaten anything. Ladies and gentlemen, that's dangerous. Because we're talking here today, you got to take that protein in. You got to do the exercise. And these drugs are telling you, no, you don't. You ain't got to do your exercise. You ain't got to take protein in. You're full and you're doing just great, because look at that scale. That scale says you're losing weight. You're losing muscle mass, and you lose 15, 20%, up to 40% muscle mass. It's not going to come back as we age. As a matter of fact, I started my resistance training and I am nowhere near the muscle mass that I need to be. All right. So this was that particular study. The same kind of study showed here, New York University, Langone, New York Health, that came out in the ASMBS in 2025. Clinical trials of GLP-1 medication support substantial weight loss, but real world outcomes may be lower because of cost, access, and that's the key: access, discontinuation, and side effects. Everybody's going to get side effects. Now, like I said, I'm going to continue to give the drugs, but I'm using it for special reasons. You got a stall. I got a 700-pound person that I need to operate on safely. I'm going to get that person down with the GLP-1 drugs in order to operate on that person safely. But that person is going to be under my guidance. They're not going to be losing muscle mass. All right. All right. So again, this just kind of shows the data. Conclusion: GLP-1 drugs are useful tools, but real weight loss is often far below trial expectations, because you don't have the nurses, you don't have the weekly check-ins, you don't have the dietitians, you don't have that environment. That environment in a trial is very, very controlled. That's why you get the excellent results. But then they put those excellent results out there, and everybody on who's a YouTube influencer says, hey, they show 22%. This is great. Nah, that's in a controlled trial. You put that out there in real life, you're not going to get that. Okay. I'll stop that share, and let's see. I'm going to be on time today. All right. So anyway, that's one of the things. I got another. I'm going to share the other presentation, a slide presentation, just again to reiterate what we've got to do as far as exercise is concerned, because we really gloss over the exercise. And I'm just as guilty as everybody else, because when she called me out on that, I was like, whoa, you're right. You're absolutely right. Because I tell you, I says, listen, eat this amount, eat these 4 pillars and all this kind of stuff of have these 4 pillars as far as our protocol is concerned. And fitness is one of them. Well, what is fitness? Because every single person came in this week and says, listen, I do my walking. Walking ain't good enough. Let me see if I got a few more minutes, so I'm going to try one other thing. Number 1, number 2. Let's see what happens with this one. The anabolic shield. This is basically the flaw in eating less, the dietary thing, and then even the flaw that we have as far as making a very, very small pouch. The eating less part is only one aspect of it. That's a calorie deficit. That's the trigger. Then that calorie deficit then has to go into muscle and fat oxidation. And that's when you do that calorie deficit, that means you're not eating protein. And that means you're not doing the things in order to keep the muscle mass. Then you're going to begin to lose your metabolic engine. And when you lose that metabolic engine, you're going to get a lowered resting metabolic rate. What does that mean? Well, your metabolic rate is what causes you to burn the fat while you're sleeping. Not the drug while you're on the couch, but the muscle is that drug. The muscle is that drug that we've got to preserve at all costs, all right? And then the lowered resting metabolic rate, the same kind of thing. All right. So put my glasses back on. The biological efficiency trap, your body naturally defaults to energy efficiency, meaning that one of the most metabolically expensive things that we have on our body is muscle. So if we don't do anything with the muscle, just like the term, you don't use it, you lose it. If we don't do anything with that muscle, if we don't, and walking in it, walking is the part that actually is going to increase our VO2 max and all that. That's important. That's why we separate it into 3 and 3. But walking is not it. Everybody tells me that they walk, and I appreciate that. But I really need to make today all about resistance training. Because if we don't do that, we're not optimizing our best health. And that's what we're trying to do here. So without a specific biological mandate, it views muscle tissue as an expensive luxury. Just like they said that you got an expensive car sitting in the garage, you're gonna have to get rid of it in this days and time. So if you starve the engine to burn the fuel, the body will eventually scrap the engine. So it's going to get rid of that muscle. So there's nothing magical about it. There's nothing magical about muscle loss. It's expensive for your body to maintain, and your body is smart. Your body says, they ain't using that muscle. Let's get rid of it. It's not doing me any good. And you get rid of that muscle, you slow your metabolic engine, you get rid back into the problems of insulin resistance and the problems that I had, and you don't want to go there. Trust me. So the overweight paradox, signal versus noise. As we are today, we got an excess amount of fat in our bodies and basically age. So age and fat don't, those are the two things that gives us a lot of noise. So as we age, we've got to shout louder. And what they mean by shout louder, or as we fat, you've got to get a protein signal, a protein pulse, as well as the right type of exercise. I'm going to show you the exercise in just 2 seconds. But the right pulse is going to be 40 grams. So I always talk about 30 to 40 grams. Cut it out. I'm going to make everything easy for you to remember. 40 grams of protein is what you need. This right here, is basically my go-to, because I'm in the operating room. I don't have a whole lot of time to eat 3 or 4 whey protein meals, like salmon, like chicken, like pork chops, or like for vegans is the rice protein, soy protein, pea protein. I don't have time. So these are easy to do, but let me tell you what I do with this. This is 30 grams of protein. So I got to have 40 grams. So I'll add a little bit more to it. But even this is convenient. It is not as good as this. This is the whey protein isolate. This has the 3 grams of leucine in it. But again, it only has 30 grams. So I'll take a scoop and a half of this, put it in water, and drink that for my very, very first protein meal. But on the days that I'm fasting, on the 18/6, the days that I'm focusing on fasting, I'm going to take 40 grams, in that between 12, 3, and 6. I'm going to take 40 grams of protein pulses. And we'll get into it in just a second. I hope this slide gets into it. I haven't reviewed these in a while. But that's 120 grams of protein. Now, some people say you got to have a gram of protein per pound. We may get there, we may not. But from what I've heard from all my patients, nobody's even getting 100 grams. That has got to stop. you got to get more than 100 grams of protein, full stop. So when I take this, I know that it's lacking in 10 grams of it. I'll try to get those with 40 grams, but this also doesn't have, because it's convenient and I take it with me and everything so I can drink it on the fly, but I also have to combine it with this leucine. So this doesn't have the 2.5 to 3 grams of leucine, so I gotta give it leucine. So what I'll do is I'll shake it up, take a little bit out of it, take that leucine out of there, and I'll have this, and I'll pour this leucine into here. Now I'm not very good at it, so I actually use a funnel. So you get these little funnels off of Amazon all over the place. So I got the cup of leucine, and I'll put it into this funnel, and it'll just kind of go into the thing there, and it's all in. Not yet. Give it all in first. I'm a little slow. But this leucine comes in 5 grams. You don't need to use the whole scoop. Let's just look how small this scoop is. So you just fill this half thing up halfway. You got the 2.5 to 3 grams. All right. Then you use this little handy dandy $2 funnel, put it in there, and then I'll put my cap on top of it, shake it up, and basically this is going to be my protein shake. Okay. Now, when I got time and all this kind of stuff, I'll go ahead and mix my whey protein isolate shake, my scoop and a half, put it in some water, not a whole lot of water because I don't want to make my stuff really, really full. And if you've had bariatric surgery, you don't want to make yourself really, really, really full in the beginning because you'll never get it down. But I'll put it in there and this will be my first meal. If I don't feel like eating at 3 o'clock, this will be my second meal. Usually on my third meal is going to usually be some salmon, some chicken, or something like that, and that is what gives you your protein pulses. All right, but that's just the first part. All right, so let's go. The mechanical override. We've got to concentrate on this. This is what this is all about. We've got to stress that muscle. And like I was telling you before, if you're just kind of going into the gym and you're just kind of casually lifting our weights and you're doing 10 reps and you get through 10 reps and you're not even straining, that ain't enough. I'm sorry to say, and I know with a passion, I know you don't want to hear this because I know how much people hate exercise. They definitely hate resistance training, but it's a must. And we just, as a medical professional field, we just hadn't paid enough attention to teaching patients what they truly need. We teach people and we're giving people what they want to hear. So you go to your doctor, they're going to tell you, eat right and exercise. And that ain't going to help you. That's not. It really is not. All right. So distinguishing movement from mandate. Examples: the goal, mechanical tension, biological signal, and mTOR pathway. Random movement, walking, gardening, or light cardio. Things that people tell me they do all the time. Yeah, I walk all day at work, doc. I'm working for the airport and I walk all day. Nope, that ain't it. Okay. So that's just random movement. The goal is energy expenditure. The mechanical tension is low or insufficient. The biological signal is just homeostasis, meaning you're going to just stay where you are. And does it activate your mTOR pathway, your muscle maintenance signal? No. Progressive resistance, what we're talking about, lifting heavy loads, and I don't mean to put the word heavy in there. They've got to be heavy enough to you to cause your muscle to feel it, that you can lift 8 times, and that's all you can do. So you gotta figure that out. And you're gonna get structural adaptation of your muscle, and it's highly disruptive and it has to heal, but when it heals, it's growing. That's a survival mandate, and it does activate your mandate. So this is low intensity activity, does not threaten the body's homeostasis enough to halt muscle removal. So just walking, getting on the treadmill, just walking and running every day is low intensity activity that's good for your heart. You need your heart, right? It's good for your heart, but it is not gonna accomplish what we need to accomplish. I'm going to finish up here. So calculating the minimum effective signal frequency is 2 to 3 times a week, 60 to 80% one rep max. I just showed you that. I can do one rep of arm, and I'll do the shoulder, and I'll see what on the machine. I'll see what I can do one time in good form, and I mean good form. I don't mean doing this trying to get it up. What's the maximum amount you can get up in good form? And usually it's about the same amount. I can get about 40 pounds up in good form. So I'll take 60% of 40 is 25. 24 is actually, but I'd round it up to 25 because there's no 24-pound weight. And when I get real frisky, I'll go to 80%. So 80% of 40 is 32. 8 times 4 is 32. I'll round it up to 35. And I'll do my 8 reps of shoulder presses with 35. That's me. That's not you. I want you to start a lot slower and a lot lower than that. All right. And then I'm going to progression. So how do you go? Well, it depends. You're going to begin to start to see your fat go away, but maintaining your muscle mass is going to increase your longevity. Okay. Selecting the instruments. Now, I do not want you to go out there. I know they mentioned it doing squats with barbell on your back. Do not do that. I'm not your doctor, but well, I am some of your doctor, but I don't want you to do squats. If you're going to do squats, I want you to do air squats. You know, this you just go ahead and basically just kind of go down and up and down and up and get as far down as you can without hurting your back or anything of that sort. And you're going to do about 20 of those, and you're going to do 20 of those about 4 or 5 times a day. When you get your muscle thighs built up a little bit more, then you're going to add some 5-pound dumbbells, and you're going to do the squats with those dumbbells, okay? And then as you could continue to progress, you're going to do the lunges. So we're going to be mapping out over the next several weeks the types of exercises that I'll want you to do to satisfy that need for you to keep your muscle mass. This is best for overall musculoskeletal and connective tissue, safety, moderate. So don't necessarily start out with free weights. The most important thing is safety. And so do the resistance bands or the machines. The machines basically have a high level of safety, built-in safety stops. Okay? All right. And then, like I said, the bands and the body weight. This is just as good. You don't really, to me, you don't really have to get a gym membership in order to do your lat pull down and all that kind of stuff you do. But you can do your push-ups, you can do your bands, and you could do your shoulders with the bands. You don't have to go to the gym. Okay? Don't have to. The chemical like ignition, and we talked about this before, you got to have the 40 grams. It says 30 to 40 grams. It's the more fit people need 30 grams. But when you get to the level where you got excess amount of fat, that causes noise interfering with the signal going to your muscle. Age causes noise interfering with the signal going to your muscle. So I'm going to make it easy. We need 40 grams every time we take it in. Forget about the 30 grams. So 40 grams on the days that we're going to work out, we're going to take 4 40-gram things. We're going to take 12, 3, and at 5 o'clock, we're going to work out. Then the next protein we're going to do is 6 o'clock. And then the last protein we're going to do is a casein protein shake. And the reason we do the casein protein shake is that we worked out. And we need to continue to make sure that our body is getting protein throughout the night. Casein is a slow digesting protein so that it continues to feed your system throughout the night. We're not going to do the casein protein shake when on the days that we're doing fasting, the 18-6. We're only going to do the casein protein shakes when we do the 16-8. I know this is all confusing, but I'm going to, like I said, I'm going to put this all on the site again, and so it'll come to you, okay? If you take in 10 grams of protein, you only get 1 gram of leucine. That ain't going to turn that engine on. If you take 20 grams of protein, it rattles the lock. It ain't going to turn that engine on. I like this slide. But if you take 30 to 40 grams of protein, that's going to give you 2.5 or 3 grams of leucine. That's going to turn it on. Okay. And like I said, this right here by itself doesn't turn it on. Okay. And you got to add, and this little thing of leucine here, that didn't cost much. But if you're using these as cool, that gives you the amino acids, but it doesn't give you the amount of leucine because leucine is the key. I don't care if you could take in 10 of these, but if it doesn't have leucine in it, what goes? It just gives you protein for your body's other support systems. Muscle full effect. This is an inaccurate slide, so I won't spend too much time on it. But basically, once you take that 40 grams of protein, that taking any more than that won't do you any good. Is what it's going to say. So it's recalcitrant. If you take 60 grams or 70 grams in one meal or whatever, the extra 30 grams that you just took in is not going to do you any good. It'll just go to your body. You'll use it instead of using fat. Evaluating daily efficiency, the grazer, 15 grams per meal. You don't turn that mTOR on. Fails to achieve the 3-gram leucine threshold. So if you're eating and you're grazing, you're eating protein all day. Yeah, I ate a couple of eggs, I ate some bacon. For lunch, I had me some tuna. None of those things reach the 2.5 to 3 grams of leucine. So you'll tell me, yeah, I got my protein. This morning I had me some bacon and some eggs and some ham. For lunch, I had me some what did I have? I had me some ham, some this kind of sandwich from Arby's. But none of those things as the grazer will get you. That's a 15-gram meal of protein. It's not going to get them. You'll still have muscle loss. One meal a day, OMAD, is doable. It's doable. One meal a day is doable, but what I mean by one meal a day is that you're taking, I do that quite a bit. I'll take in salmon or fish or chicken at 6 p.m. on one day. But the other times during the day, I'm taking in, I'm taking in these little protein things here. But and I forgot to mention that it doesn't really matter to me. It depends upon how you feel about taking in protein shake versus taking in food that has protein. You can mix and match them. If you're going to take in 4 protein pulses, 2 of them can be food, 2 of them can be shake. 1 of them could be food, which is what I do. The other 3 are shakes. Mix and match it. Or if you just don't like taking food in at all one day, you can take in 4 shakes. Doesn't matter. All right. But basically, the 4 protein pulses every single day, 40 grams, are the 3 protein pulses on the days that you're doing your fasting are without a doubt necessary. Okay. And the pulsar, this is what I'm talking about. This is where you get the maximum muscle retention is basically you're hitting those protein pulses, those 40-gram protein pulses every 3 hours. All right. All right. Executing the 40-gram blueprint, prioritize protein first. The top-up strategy, if a meal is naturally low, 2 eggs equals only 12 grams of protein. Use a whey protein shake to bridge the gap and force the biological signal. So I commonly do this. I'll eat a couple of eggs and some bacon, but I know I'm not hitting my protein, so I'll add a little whey protein shake. I always add on my first meal of the day whey protein shake, whether I'm going to eat or not. All right. And connective tissue support, stack 5 grams of collagen peptides. That's too much for me to talk about today, so I won't. Collagen is something that you can add in there, and it's a good thing, but I don't want to overwhelm you today. So the 4 protein pulses, it says 30 to 40 grams. 30 grams is for other people who are just trying to maintain muscle mass and who don't have the other issues that we got. For us, we get an excess amount of fat that's blocking the signal. That's the noise. And as we age, and if we age and we're over if we're over the age of 50 and we're obese, then we got a dual noise barrier. So we really gotta take it up to 40 grams and then do our protein, then do our exercises. All right. So redefining the metabolic trajectory, we got to basically do the caloric deficit and the anabolic shield. We want to oxidize the fat, but muscle preserve. Probably the most important point, muscle preserve. All of the drugs that we're going to be taking and talking about, and it's going to be coming out, and they're going to have all these movie stars touting them. Their basic thing is for you to lose weight, and that weight is going to be muscle mass. Don't fall into that trap. And if you do want to take those drugs, make sure it's done by a metabolic specialist. I'm a metabolic specialist. Come to me. I'll give you the drugs. We're going to try it, but I'm going to be controlling it with looking at your muscle mass and all that kind of stuff. Okay. Elevated resting metabolic rate. If your muscle mass goes away, that goes down. We want it to go up, so you want to maintain that. Long-term metabolic health and fat loss is what we're all about. Okay. Well, I'm going to stop that share. And like I said, what I'll do is I'll get Andrea Riggs to come back to us and give us a protocol of what we're going to do as far as resistance training is concerned. I hope you got that 60 to 80% one rep max idea, but you got to put a little bit of stress on that muscle at least 2 to 3 times a week. Okay. And so when you come to the office next time I see you, for those of you who are our patients, I want you to tell me that, yep, I started my resistance training exercise. All right. All right, ladies and gentlemen, I really appreciate you all being here. If you've learned anything new today, put it into the chat box. Say, I learned something new. Wasn't a whole lot new today. We just had a different topic today. But if you did learn something new, tell me you learned something new. And next week we'll expand on this a little bit more, but we'll add something even cooler next week. So don't forget to come on back, okay? All right. You all have a great weekend. I really enjoy this. I hope you enjoy it as much as I do because it's free teaching. And I know that most people don't value stuff that's free. Hmm. But you know, it's just what we're supposed to do. Physician, the old Greek meaning of physicians means to teach. And it makes me feel good when people come back to the office and they're doing so wonderful. For everybody who is here today, who was in the office this past week, the ones that I said, man, you look great. You all did look great. And I really appreciate that you're taking the advice and all that kind of stuff because you all look wonderful. And I know you were beginning to feel wonderful. And that really makes an old man like me. I ain't gonna call myself old man. That really makes a man like me feel good, feel proud. See y'all next week. Have a great weekend.